Welcome everybody. It's lovely to see everybody introducing themselves in the chat. So today we'll be presenting our webinar where we'll be looking at the opportunities for palliative care nursing education and practice across continents. So this is a collaboration between the Worldwide Universities Network and a project that we've been working on that I'll talk to you about in a minute, and the African Palliative Care Association, who have just been amazing in supporting the project and making sure that this webinar happened. So my name is Dr. Steffi Meme, and I'm a researcher at the University of Sheffield. And today I am joined by Mary Idrisu, who's an assistant lecturer and PhD student at the University of Ghana, by Dr. Yakubu Salufo, who is a lecturer at Lancaster University, Dr. Eve Namisango, who is a research manager at the African Palliative Care Association, and Professor Julia Downing, who's executive director with the International Children's Palliative Care Network. So at the bottom of the screen, you can see all of our one partners and external partners who have been really key to the projects that I'm going to talk to you about now. So welcome to the webinar. This is really one of the last outputs from the project that I'm going to speak to you about at the moment. Central to our project was not only documenting palliative care education practices, which Mary will discuss in a minute, but also making sure that our findings were shared widely through academic publications, presentations, and webinars such as this one. So just to give a brief overview to the project that this webinar comes from. A nurse and somebody who is running a community organisation, one based in the UK and one in South Africa. You can see their picture in the kind of sort of the top left of the photos. They realised that there was a need for palliative care education across the world, basically, which is where this study comes from, and it's very much a global issue. So the project we put together was focused on supporting undergraduate nurses, in particular palliative care education needs. And what happened throughout the project was that we realised that we needed to have an underpinning ethos of reducing inequalities. So it responded to the following sustainable development goals that you can see on the screen. So what the project wanted to do was to undertake a literature review, which Mary will be presenting on in a moment. We collected data from 5 different countries. These were, and we're still in the process of collecting data. So these were the UK, New Zealand, South Africa, Uganda, and Ghana. We have, as I said, tried to ensure that our findings are spread far and wide. This is a photo that's hot off the press from the European Palliative Care Association conference that took place last week, just last week. So there we have some of our team members attending there and presenting a poster. And then today's webinar presentation is another way that we're hoping that some of our findings get out into the wider world. So I just briefly wanted, before I hand over, to touch on the fact that through our project, it wasn't a lot of, it wasn't a huge project, but what we wanted to do was make sure that we were focused on global inequity. So we really did our best to make sure that all of our project partners were able to attend our in-person meeting that was held in Kimberley, South Africa last year. And we didn't quite manage to do that, but then those team members were able to attend the conference last week. So we really tried to kind of overcome these challenges with visas and things like that, which tend to happen in international collaborations. The ethics processes are very rigorous. We made sure that, we amended them for each country to make sure that what might be okay for the UK was also okay for our Ghanaian teammates. In terms of funding allocation, we know that institutions in the global north tend to be allocated more funding. So we tried to ensure that we made that playing field a bit more equal. In terms of impact and next steps from this project, I've got this lovely sort of diagram with all these different colours because of the diversity of roles that are included within our research team. We had some nursing educators who are going to take curriculum development work forward in the field of palliative care education. And then we have some people who are more focused on the academic side, and they're going to be develop palliative care projects, international ones, probably going to the Medical Research Council for some funding. And then we also looked at the methods that we use. So some of us are working more on what sort of methods we're using to conduct research. So we've recently submitted a paper where we are basically trying to promote equitable global palliative care research, talking about our experiences of this project and how that might be able to impact on future research projects. So that's a little overview of the project that brought us to this webinar today. And I look forward now to hearing from our other panelists who I introduced. So our first talk is from Mary Idrisu, who's assistant lecturer and PhD student at the University of Ghana. And she will be talking about the systematic review of educational interventions for palliative care in low and middle income countries. Thank you very much, Mary.
Thank you, Steve. Okay, so the systematic review is set to explore palliative care educational interventions among nurses in low and middle income countries. And then if you see the logos down there, these are the partners involved in the project. Next slide, please. So this is the outline of what I'm going to talk about. So my focus is going to be on the findings of this particular systematic review. Please, next slide. Next slide, please. All right. So we are all aware that there is a growing disease burden in the lower and middle income countries with respect to cancers, cardiovascular conditions. Please go back. Cardiovascular conditions. And then we are told that the world will need about 87% palliative care to be able to care for its population. But then in the high income countries, we have a 70% increase now, and then the target is 87%. However, in the lower and middle income countries, the achievement now is 30%. And then palliative care, there is also inadequate palliative care training among nurses who account for almost 50%, and it's now even crossing the level of 60% in our part of the world. Next slide, please. Next slide, please. All right. So there is a need to establish a palliative care educational intervention in lower and middle income countries, and the availability and then the nurses being able to be familiar with the palliative care principles and supportive care principles to be able to take care of their patients is very, very paramount. Therefore, this systematic review sought to synthesize interventional programs that sought to improve nurses' education in terms of palliative care in lower and middle income countries. Please, let's start. Now, in terms of methodology, we use a systematic review with narrative synthesis. The focus of this presentation is not going to be about how we got the findings, but then to share the findings with you. So before then, the protocol was registered with Prospero, and that is a registration number we see up there. Please, let's move on. And next slide, please. All right. So with the inclusion criteria, the focus was any intervention that deals with nurses, all categories of nurses, and in all settings, be it at the hospital, in the care homes, in the community, everywhere. And then the exclusion has to be with any healthcare professional who is not a nurse or a midwife. So the term nursing is a generic term to include nursing and midwifery. I know in certain settings, when they say nurses, it includes midwives. Then the intervention was any educational material or educational case that seeks to give any education or maybe any knowledge to a nurse to be able to equip the person to be able to provide palliative care was what was the focus. Thank you. Please, let's move on. All right. So 4 data bases were explored, and these were the Medline, Sinals, PsycInfo, and then Cochrane Library. And out of the 136 countries in the low and middle income countries, 28, we had 56 eligible studies from 28 countries out of the 136. And then the breakdown will be given later. Please, next slide. All right. So we had 56 studies, eligible studies. Out of these 56, primary studies were 49, and then we had review studies. The review studies were 7. So you look at the review studies, what we have in there is 7. It's not supposed to be 6. So we have 4 systematic reviews, 1 scoping review, 1 integrated review, and 1 mapping review. Let's move on, please. All right. So these are the origin of the included studies. We had 26 from Asia, 17 from Latin America, then 12 from Africa, and Eastern Europe 1. I brought this so that we'll be able to look at the implications of the study with respect to research. All right, so please let's go to the next slide. So with the target population, the included studies target 18 of the studies targeted student nurses. Then 6 of the studies targeted nurses and other healthcare professionals, physiotherapists, medical students. But because nurses were part of these studies, the studies were included. Then nurse educators were 2. We had oncology nurses and other general nurses also forming part of it. The total sample size was 14,084. And sorry, I think our person is covering. Great. And then the individual study sample also ranged from 6 to 10,048 participants. Please, next slide. Thank you. So if you look at the purposes of the included studies, I found 2 main purposes. So one was looking at evaluation of all the interventions. So effectiveness of the intervention on attitude, confidence, communication, a whole lot. Then another bit was looking at training content. So 19 of the studies were also looking at training. And then the training, we have training in terms of the curriculum assessments, the development, nursing empowerment, the challenges they face with respect to whichever pedagogical approach they used. Please, next slide. Thank you. So with the findings that were gotten from this particular review, we had 3 main themes coming out of the analysis, the thematic analysis. So one theme is looking at the training content. And with the training content, a kind of look at the complex symptom management, looking at empathetic communication, decision-making, bereavement, support, post-mortem care. These were the content of the training people actually gave with respect to the included studies. Please, next slide. Sorry. So then when it comes to instructional approaches, this very slide is very, very important. So with instructional approaches, we realized that most people were using lectures with PowerPoint slides, had people use webinar series like we are having now to deliver the content of palliative care. There were others who used role plays with high fidelity mannequins, and then storytelling. Others use scenario creation and reflection exercises. A couple of the studies also use riddles and poems with theatrical performances. Others use mentorship and experiential clinical learning. With this particular, these instructional approaches, it came out that storytelling, role play with high fidelity mannequins, scenario creation and riddles, and then the mentorship were most effective because the students saw the real, near real life situation, how palliative care is given in terms of whatever knowledge they had, and they were able to mimic it in the near real life situation. And with respect to the PowerPoint slides and also with the virtual approaches, in a way it was effective, but then most of the studies reported that participants on some of the interventions fell off along the line, and by the time they had IT personnel to hold them onto the program, the program had moved far and they missed most of the content of the training. Please, next slide. So the next finding, and which happens to be the last, is if evidence of effectiveness. So the training approaches kind of build nurses' communication skills, help them to build some form of confidence to be able to deliver palliative care, also acquire knowledge to be able to take care of people with life-threatening conditions. And also, they also had self-efficacy with respect to psychosocial support. Let's please, next slide. All right. So I will dwell here a bit more here. The findings of this study they have implications on research, education, and then practice. So with research, we realized that this study, we had from 28, the 56 studies were gotten from 28 countries out of the 136 countries in the lower and middle income country. And then it's sad to note that in West Africa, where I'm coming from, there was a single study that was gotten with respect to this particular systematic review. And then with the studies, the origin of the studies, we realized that Eastern Europe had one. So that is with the ones included in the 28 countries. But then there were, out of the 100 and plus countries that were not, we didn't get any paper. We couldn't access any paper from there. I think that we need to do more research. If we have done it and we haven't put it out there to the scientific community, we need more research in this area. And also in the Eastern Africa, Eastern Europe, we need more research coming from that part of the world. With respect to education, we realize that looking at the pedagogical approaches, most people believe that doing it and letting me mimic the real life situation kind of help a lot. But when it is lecture and discussion, I have the lectures, and then when I go, I don't know how to do it because I wasn't allowed to do it to see how I'll perform in the clinical area. And poems, in terms of theatrical performances, this and then the storytelling, these are the approaches that are proven to be effective. So with nurse educators, I think that looking at the findings from this study, we need to be able to use more effective pedagogical approaches to be able to effect these things and these changes in our students. Practice. It happens that palliative care, according to WHO, is lacking in our parts of the world. It's inadequate. Meanwhile, we are the people whose palliative care need is down. We are supposed to achieve the 87% by 2060. Unfortunately, we are at 30%, which means that we need to be able to inculcate whatever knowledge we have acquired in the field in the clinical practice, so that those who are having life-threatening conditions will be able to achieve, will be able to get the needed palliative care support their conditions demand. Please, next slide. So I've come to the end of my presentation. I know that there are others who have, thank you. I know that there are others who have a lot more questions and comments to pass on. So at this time, I will hand over to my senior colleagues for them to also continue. Thank you very much.
Thank you so much, Mary. That was it was a really important talk. I mean, I've certainly got questions, but I think in the interest of time, what we'll do is if everybody can keep their questions until the end, we've set aside about 20, 30 minutes for people to ask their questions, either in the chat or by putting their hand up and speaking. So if it's okay, we'll move on to our next speaker. I will stop sharing my screen so that Dr. Yakubu Salifu can take over. While you're figuring out your slides, I'll just say that Dr. Yakubu Salifu is a lecturer in palliative care at the International Observatory on End-of-Life Care at Lancaster University, and he is also the co-director of the Lancaster University Africa Research Hub. So over to you, Yakubu. Thank you very much.
Yeah, thank you very much, Steph. Can you see my slide?
Yes.
Yeah, thank you very much. So I'm really delighted to be, speaking at this important forum, and my brief is to look at how we can bridge the continent for palliative care by looking at insight from Compass Ghana. So Compass Ghana is a charity that is registered in the UK and also registered in Ghana. So there are two different entities that work, hand in hand to help in the delivery of palliative care. So what the UK arm does is to solicit for support in terms of donation resources to help the Ghana arm to deliver the care. So this about me. Most of you may know me, but others may not. So I'm a nurse by background, and so that's one of the influential aspects of the work that we're doing. So Compass Ghana developed from my PhD work. So how I'm using my nursing background and my academic skills in terms of research to make an impactful change in palliative care delivery in Ghana. And when Mary was speaking, she talked about the fact that there's some kind of a depth of research in sub-Saharan Africa with respect to palliative care. There are some work that has been done, but if you go into the nuances of it in some specific disease condition or maybe palliative care in general, it's really lacking. So I'm just not, in order not to bore you, I just kind of want to give a little bit of a bird view, overview of palliative care globally. So about 40 million people need palliative care. However, less than 15% of people receive the care. So this is really, really a concern. And out of this, about 2/3 of people needing palliative care live in low and middle income countries. And that's why I think it's really, really useful for us to, come in and see how we can rectify this situation. So it is really, really important to understand what works and for whom. Palliative care is a very, very, very complex, field, and very, very, excuse me to say, very vague term when I teach my students, because what is palliative care within one context may not be necessarily the same within a different context. And here again, even with the delivery of palliative care in the UK and the US, what is being what is palliative care in US is completely different from that of the UK. And even if the same country, you move from one setting to the other and things are not the same. And these are as a result of resource disparities, cultural differences in infrastructure, and the sort of funding that are available. So in Africa, for instance, most countries do have a very negligible budget or out of their GDP that is, allocated for health. And it becomes much more, insignificant when it comes to palliative care. So it's really, really important for us to be aware of this so that we will know how we approach that. And of course, demographics of the population also affect how palliative care could be delivered. So I suppose the ideal situation will be what we see in this picture, everything well organized, nice, and, things are working as according to plan. But in reality, that is not what happens. And I'm really, really, fascinated by Aaron Higginson and colleagues' work that says that, palliative care is no longer a luxury, but a necessity. And by the WHO, World Health Organization, conversion about palliative care, it needs to be included in the primary health system so that it becomes much more accessible to people who need that. However, there's problem with the healthcare infrastructure, especially in Africa. There's also an issue around access because of culture, geography. So, for instance, those of you who are from the UK, Ghana is almost the size of the UK in terms of landmass, but, we do not have institutional palliative services, or maybe the few palliative care institutions where people can get outpatient services are very, very geographically, dispersed, and that can affect access to care. And also there's the issue about capacity, skilled healthcare delivery. And I think Mary talked about this one during her presentation about the systematic review. The sort of training that people need to deliver the care is also really important. Currently, Ghana do include some aspect of palliative care, introduction to palliative care in, the training of nurses, but I don't think it's sufficient to equip nurses to provide this care. Sorry. So in reality, this is what we see in some places, and I think it may not be very different from other African countries and elsewhere as well. So access to care can be very problematic. In some cases, people have to travel, cross rivers, walk on foot for several miles to deliver the care. And in most of the situation, these are done by nurses. And that's why it is really critically important to involve nurses in the delivery of palliative care so that those who need the care will receive it and the care will be accessible to them. So just a kind of a snapshot about the support system in Ghana. Ghana do have health insurance system. However, the health insurance system is not automatic. You need to register, you need to subscribe and pay for it to be able to access care. And looking at the slide here, you can see a lot of, pictures about people soliciting for support, be it brain surgery or maybe tumor that they need support, being it, renal disease. We do not have a system that support people with palliative care needs. So on this slide, you can see Michael on the top right of my slide. And Michael had a brain tumor and needed about 30,000 to support his treatment. And this was, circulated on social media. By the time people could, contribute, he has sadly passed on. And the same thing happened to, Okran, who is down there with renal condition. So what this means is that we need to get a system that will help people with palliative care needs and move from the ad hoc support system where people, will need to advertise their disease on national television for support. And sometimes such support even comes quite late. So based on the work that I did during my PhD, there were 3 main issues that needed to be attended to. One has to do with home-based palliative care that is usually unsupported by health staff. And here, although Ghana do not have institutional palliative, care to provide, hospice care, whatever. I know currently there's some private ones that are, coming up. But the informal system is really, really good. Family members want to provide care for their dying patient. So there is that kind of support system that we can leverage on. So there's also an issue around cultural response, So my work looked at men living with prostate cancer, and with prostate cancer specifically, there's an issue around masculinity because obviously it affects, men, issues around erectile dysfunction, issues around men's status in society, and issue around stigma when you have people having incontinence, for instance. There's also an issue about palliative care that is delivered in resource limited setting. For instance, if you have somebody who has incontinence in a high income country, although this is a big issue, it wouldn't be as big an issue as compared to maybe in resource limited context where you may have difficulty in getting access to incontinence pad to kind of mask the situation. So those people that I did interview, some of them even have to, seclude themselves because the kind of incontinence that they had made them smell and they didn't want to get in touch with people. So I talked about Compass Ghana. So the picture that you see there is the board of trustees of the UK arm that is helping, delivery of palliative care in Ghana through their partners in Ghana, the board of directors in Ghana. So you can see me there and John and Katie. So the three of us come together to serve as the founders of Compass Ghana. So John is the chief operating officer, Katie is the chief clinical officer, and we are kind of the executive looking at the implementation of the care. And as I said, it is based on research findings, it's based on practice, information from people who are delivering the care to kind of design an approach that is very in line with the aims and the aspiration of the people. So not only that, Mary talked about, empowerment of staff. So here in Lancaster University, we have the medical students who have established Compass Ghana Society. So right from the beginning, we have medical students who have developed interest in palliative care, and it's our wish that they will venture into the delivery of palliative care, and so that will solve the issue around health staff capacity. So this is one of the papers from my PhD, and I really love the quote. The quote came from one of the participants who said, "My wife is my doctor at home." And that kind of encapsulates how care in Ghana is being delivered, unsupported by health staff. I also talked earlier on about culture and beliefs, and this particular paper talk about where men talked about the problem that they face in accessing palliative care. So if the care is not aligned to the culture and the beliefs and aspiration of the people, it means that it's not going to be, taken. So men were very, very particular about, they not being men enough or not having their balls, having erectile dysfunction, and moving from head to tail. And that talks about the fact that in a typical Ghanaian culture, which is a patriarchal society mostly, the man is the head of the family. And if these men who were receiving palliative care, some of them thought that, they've moved from that high level of being the provider for the family to being cared for. So in providing care for this group of people, you need to be very aware of the cultural connotation of some of these things in order to address that. So that is the Ghana board, some of the Ghana board members with the UK chair who visited them. So currently what we're doing is to use a whole system approach in providing palliative and end-of-life care in Ghana. And to just quote from Nigel Krebs, who used to work for NHS in England, a book that he published, he said, "Health is made at home, whereas hospitals are for repair." So based on this kind of principle, we are using a kind of a whole system approach that incorporates the society, communities, the chiefs and people to come together so that they will be able to provide palliative care. And as I said earlier on, there is already a system in place. The informal system is very robust in Ghana, and we think that leveraging on that will be really useful for the delivery of care. So I'm just getting to the end. These are some of the engagement that we've done. And a key among them is the palliative care awareness call that we did with Hospice Africa Uganda. We're really passionate about this, and we were very thankful for the members from Hospice Africa Uganda who flew several miles from Uganda to Ghana for about a week to provide, palliative care training to staff at Asamai SDA Hospital. And as you can see on the slide, there has been a lot of marathon that has been run to solicit for support. Thanks to Jamie and his brother, he's been very supportive. They are the sons of John. So that's our chief operating officer. So that's really good to kind of know. So with the awareness course that we did, it has been really important. We've had a lot of people contacting us about, palliative care, but everything is, reduced to money. There's little we can do without money. So there have been instances where we've, run activities to solicit for support. You can see John and Katie there in their Compass Ghana, T-shirt, and you can see the facilitators from Uganda who did amazing job in Ghana training people. And aside that, Compass Ghana and Lancaster University also did engagement visit in Ghana last year to help train health, professionals in research grants and how to kind of come together to solve common problem for palliative care in Ghana. So there has been quite impactful and success story that we have. Currently, as I said, we have a hub, a palliative care hub that has been established at Asama SDA Hospital. Then these people have also been part of online training with Lancaster University. And we were very pleased to have Future Learn. Those of you who know Future Learn, online service provider, they provided them, they waived the cost of the training for all the staff through Compass Ghana. So you can see a picture there with staff with their certificates. And John also leading the team, mapping up what to do. So just to wrap up, we have partners in country. So we have Ghana Palliative Care Association, SDA Hospital Asaman, a lot of institutional facilities, Peace and Love Hospital, Konfanoche, Matthew 25, a lot of them. So it is about collaboration, really. Then in terms of Africa, Hospice Africa, Uganda, very instrumental. ABGA, we are a member of ABGA, and we also in talk with Glenys Gale Foundation, who we met in South Africa last year. Then, of course, we have international partners as well. Lancaster University is one of them, Future Learn. Then we have colleagues from Germany and, US and also Canada. So it's really important. And you can see a picture of a beautiful lady here, Tala, who is one of my PhD students from Kuwait. She's been very instrumental in helping us to, help with donation from Kuwait, without which we couldn't have had the Hospice Africa Uganda team traveling to Ghana for the training. So you can see in this slide a nice picture with the team from Hospice Africa Uganda, SDA Hospital Asamai, and also traditional authorities who are part of the entire process. So what I believe, or what we believe in Compass Ghana, is that in our learning, we need to unlearn and relearn, and we also need each other. Thank you very much. So that's my email, and that's my Twitter or X account. And I'm very happy to take questions when the time is due. Lastly, if anyone want to, study at Lancaster University for palliative care, I'm the admission tutor, and I'm happy to have a discussion with you. Thank you very much.
Fabulous. Thank you so much, Yakubu. And I'll just echo what I said before. Please do put any questions in the chat. There's a little Q&A section at the bottom. If it's about how to get involved in the work of Compass Ghana or anything about education, getting in touch with Yakubu. So please do put any questions there. Fabulous. Right. Next, I would like to introduce Dr. Eve Namasango, who will be presenting. Eve is Programs and Research Manager at the African Palliative Care Association and Honorary Senior Health Scientist at the College of Health Sciences, Makerere University, and trainer at the Institution of Hospice and Palliative Care. While the site's getting sorted, she is also a board member at the Institute of Hospice and Palliative Care in Africa and former board member of International Association for Hospices Palliative Care. Over to you, Eve. Many thanks.
Steph, thank you for the very kind introduction. I'll say I'm not a nurse, but a very strong supporter for nurses and clinical officers in palliative care. And I'm going to talk about opportunities for palliative care, nursing, education, and practice across continents, but my focus is going to be on Africa. And as introduced, I work with the African Palliative Care Association, and our mission is to ensure that everybody who needs palliative care across the continent does have access. And we do that through collaborations and partnerships. So this is just to emphasize that the need for palliative care is projected to increase significantly globally, but the need is expected to even be higher because of the increase in incidence and prevalence of conditions that require palliative care in developing countries, Africa inclusive. And when we look at this lovely house, which is a good shelter that should welcome everybody to receive palliative care, we look at empowered communities, health policies, research, medicines, education, and service delivery, and nurses contribute significantly to all these blocks. And therefore, our regional strategy as the Palliative Care Association of Africa is to support nurses' education. And we have used education scholarships so far as a pathway to holistic empowerment. And I want to say that the African Palliative Care Association is celebrating 20 years. And on this work stream, we celebrate our key partners, that is global partners in care, who have been very supportive in ensuring that our nurses get education scholarships. And our partnership started in 2021. We wanted to ensure that our nurses and social workers get some funding to pursue courses in palliative care. And the goal is to enhance their palliative care skills and knowledge. And so far, we have awarded over 76 scholarships. And nurses continue to feature even in indicators for palliative care development. They are all over in delivering care, ensuring that medicines get to people even at primary health care level. And besides themselves getting trained, they are also trainers for the future human resource. And when we undertook an evaluation, and by we, I mean the African Palliative Care Association and global partners in care, to talk about the impact of the training our nurses have had, we were impressed that of the 30 who participated in the evaluation, 45 noted that the training had improved their ability to deliver services to their patients, and most importantly, to provide person-centered care that goes into counseling, respects people's autonomy, and understanding people's needs at a personal level. And then 38% noted that they now had good ability to engage in coaching, mentoring, and training other service providers, and others can now supervise students who are undertaking research in palliative care. And as you can see, all of this directly links back to the house that we need to welcome everybody who needs palliative care. And several institutions in Africa now offer some courses in palliative care, and these can be at certificate,
degree or diploma levels. And a list of these institutions is available via the African Palliative Care website and also the Global Partners in Care website. And I think the Institute of Hospices and Palliative Care websites. And the courses are there, the duration, the eligibility, and cost. So now it is easier to find where you can take on a course depending on where you're located in the region so that you can take your education and career growth goals forward. So I have some exciting news that in this partnership, we now have King's College London, and under this partnership, we'll be able to award some 7 scholarships for our care providers in the region to pursue masters in palliative care. And this call is still on. The application form is going to be brief, about 2 pages, and applicants will talk about their motivation, educational aspirations, professional application of the training that they are going to undertake, then career ambitions and impact. And while we encourage people to look at institutions that are closer to their homes, I'm proud to promote the course availed via the prestigious Makerere University. It is provided by the Institute of Hospice and Palliative Care. Everybody knows about this institute and Hospice Africa Uganda, and the degrees are awarded by the prestigious Makerere University. The call for applications closes on the 24th of June, on the 4th of June, but I spoke to the registrar, Dr. Nasur Buyinza, and he says that if you're caught up by a few days, please talk to him in person. They can see what to do, but I encourage those who wish to apply to make sure that you send in your applications on time. And then the call for scholarships will close on the 30th of June. And this call is soon going to hit the social media platforms and also the various websites. So I'm just alerting you, because to apply for a scholarship, you must be admitted to pursue this course in a university. So thank you very much. That's what I wanted to share this afternoon. And I encourage you to always renew the burning fire within you to deliver the best care as a nurse. Think about this important and courageous woman in the field of nursing and refuel your energy in Africa and beyond. I want to thank you so much for your very kind attention. And Steph, back to you.
Wow, many thanks, Eve, and congratulations on the new collaboration with King's College London and the masters. That's really exciting news. I'm sure there'll be some interest in that when we get to the questions and answers section. So thank you very much for your presentation. Really, really important information. Okay, so our final speaker is Professor Julia Downing, who currently serves as the Executive Director of the International Children's Palliative Care Network. Professor Downing is an experienced palliative care nurse, educationalist, researcher, and advocate. She has been working in palliative care for 30 years, with 18 of those pioneering work internationally in Uganda, Africa more widely, Eastern Europe, and globally. So thank you very much, Professor Downing. Over to you.
Sorry, I couldn't come off of mute. Let's try that again. Can you hear me now?
Yes, we can.
But you can't see my slides yet, can you?
No.
Okay, can you see my slides, or can you see the?
I can see the slides now.
Now we're cooking.
Okay, and it's not the presentation mode. You can actually see what my slide, yeah?
No, it's not quite presentation mode.
So is it the wrong way around, in other words?
We can see your presentation and we can see the next slide that's coming up. I think it's okay. I think we can see enough of the slides. Yeah.
Hang on, let me see if I can just change that. Is that better?
Perfect.
Great. Okay, so good to be with you this afternoon. And in the next 10 minutes, I'm just going to talk about children's palliative care, nursing education, and we're going to have a quick whiz around the world. And thank you to my colleagues for setting the scene to date. And I would reiterate what Eve has said about the scholarships from King's. It's a great opportunity, and I'd encourage some people interested in children's palliative care to apply as well. So, children's palliative care. We want to make sure that all children, regardless of where they live, regardless of what condition they have access to palliative care. And we know that the World Health Organization has a unique definition for palliative care, and hopefully we are all familiar with that and the definition for palliative care for children. And it's so important that we remember that palliative care is needed right from the neonatal period, right up through childhood, through adolescence, into adulthood and into old age. So right across the ages. So Yakubu set the scene generally for palliative care. If we think about children's palliative care, we know there's over 21 million children globally who need access to palliative care, but only about 5 to 10% of those have such access. So there are children around the world and their families suffering needlessly when we know how to support them, when we could make a difference to their lives. We also know that there's a wide range of conditions that people have, that children have, who need palliative care. And all this is important for us as we're thinking about children's palliative care education for nurses. And this was a study that was done that showed that less than 5%, and in Kenya at that time, less than 1% of children who needed palliative care had access to it. So in terms of the global status of children's palliative care, you can see things are developing. This was in 1999, 2011, and more recently in 2023. But there are still many countries within the sub-Saharan Africa continent, but also other parts of the world which are white here, where there is no known children's palliative care service provision. And we want to change that whole map into dark green. Now, I believe as a nurse that nurses are at the forefront of the integration of palliative care so that everyone, whatever age they are, can have access to it. But also palliative care is often spearheaded by nurses, and that should say children's palliative care. So we have a pivotal role. We can shape and guide the development of palliative care, and linking in with what Yakubu and Eve have said, we need to have programs that are culturally appropriate, they're affordable, and they're for all. And I believe that we do, and we can make a big difference as nurses, but nurses need training on palliative care. We need training on children's palliative care. So the World Health Assembly resolution, which is 10 years old this year. In fact, we're going to the World Health Assembly next week, and we've got a 10-year on side event. But they talk about education at 3 different levels: basic training, continuing education, intermediate training, and specialist palliative care training. All of this is important for us as nurses, but we believe that every nurse should have some basic training on children's palliative care. And this wider project was looking at specifically undergraduate training, and Mary was talking about the systematic review that we'd done. But we need to have training at that specialist level as well. And we've heard about that from Eve as well. So it's important that nurses have access to training across the board. And we've seen this model from Eve, and we know that education and training is a pillar to the provision of children's palliative care. So we must be providing nursing education on children's palliative care. And I just had a quick look at some of the atlases, and this is about palliative care generally in nursing schools. And you can see that in Africa, the map of Africa, there's both highlighted both medical schools, but also importantly nursing schools with palliative care in their undergraduate curricula. And you can see many countries don't have any nursing schools with palliative care in their undergraduate curricula. And if you look across Europe and across the EMRA region, it is similar. So we still need to develop nursing, palliative care nursing at the undergraduate curricula level, and particularly children's palliative care nursing. So we did a quick review, and my colleague Alex is on this call, and we did this together, looking at children's palliative care training programs around the world. We reviewed 114 courses, and it was really interesting, and probably as you'd expect, the number of courses per region corresponded to the development of children's palliative care in that region as well. And you can see that in Afro, 16% of the courses that we reviewed were from the African region. And they were a mixture of courses. Some were run in person, some were hybrid, some were virtual, some were specifically for individuals in a specific country, some were international programs. 50% were multidisciplinary, and of the remaining, there were more courses that were aimed specifically for doctors than there were for nurses, but there were quite a few that were aimed at nurses. And going back to what I said earlier about the different levels of training out of those training programs, 75% were for the generalist level and 25% were at the specialist level for children's palliative care. So really important that we look across the board. And this was just some of the indicative content of the generalist courses on pediatric palliative care. And you can see in the bottom left-hand corner that nursing care was a core component in many of the programs. And for all those that were aimed specifically at nurses, that was a key area. So we know that there are a variety of training models of delivery. We know that theory and practice is important. We know that in children's palliative care, it's not just about the skills on children's palliative care, but what about leadership? What about research? What about education skills? We also know that our training needs to be competency-based, and that it's important to get recognition of the training for our nurses. So for children's palliative care, undergraduate training might be focused more on general palliative care, but hopefully with some input into specific needs of neonates, infants, children's and adolescents. Now, this is a quick look. So the European Association of Palliative Care have developed competencies for children's palliative care. And again, they look at these 3 different areas as highlighted in the World Health Assembly resolution. And you can see here that they've looked at the competency domains at the specialist level of pediatric palliative care. And these domains are important for us as nurses. And whilst the training competence here are multi-professional, they highlight the importance of nurses and the specific skills needed within nursing. And this is how they then look at the specialist and the generalist pediatric palliative care. And that document is available through the ICPCN website. More recently, there's been some pediatric palliative care standards that have been published. And within that, there are distinct levels of palliative care which should be offered by professionals with appropriate levels of training. So these are global pediatric palliative care standards, and they then talk about the importance of education and training. They talk about it for all pediatric healthcare professionals. And whilst they do look at the importance of interdisciplinary education, they also talk about the importance of specialized education. They talk elsewhere about the importance of nursing education and the competencies needed at the different levels. So really key in these global standards. Another example, it has been in the Children's Palliative Care Education Standard Framework and Self-Audit Tool in the UK. And they look actually at 4 different levels: public health, universal, core, and specialist. And they have outlined the competencies needed. And they also help us to look at auditing our programs, whether they're nursing programs or multidisciplinary programs. So, for example, this is how they set it out at the different levels. They look at the level, the learning outcome, indicative content, and ways that we might assess students. And so all of this can help us as we develop and strengthen our nursing children's palliative care education. I mentioned also the importance of children's palliative care nurse leadership training. This is a picture of some children's palliative care nurses we've been doing a leadership training program with in Uganda over the last year. And then we also did some leadership training earlier in this year in India for both doctors and nurses. But training our nurses as leaders is key if we're going to continue to develop palliative care and children's palliative care nursing. And then there are a wide range of programs that are available. These are on the ICPCN e-learning site. These are free education programs, and we have a large number of nurses who take these courses. A wide range: pain assessment, introduction to children's palliative care, neonatal palliative care, grief and bereavement, end-of-life care, humanitarian settings. So a wide range of free resources available for training and educating nurses in children's palliative care. There are also, and you might well be aware of these are 2 big global programs, the ELNEC, End of Life Nursing Education Consortium, and they have specific courses, not just on palliative care, but specific ones on children's palliative care. And then there's the EPIC, Education in Palliative and End of Life Care, which is around children's palliative care. It came through for doctors, but more and more nurses are now being trained through the EPIC program. And I'm training next week, and we've got many more nurses on the course than we have doctors. So training in children's palliative care. And then, of course, there are a wide range of free webinars, free conferences. We're working in Ghana as well, and it was good to hear the update from Yakubu and Compass Ghana, a part of our advisory group from our project that we're currently doing in Ghana. We have monthly free children's palliative care webinars, and at ICPCN we have webinars that are free to access as well. So there are a wide range of resources and options and opportunities for nurses in children's palliative care training around the world. And just as I close, just a quick reminder, ICPCN, with the global network, working together to try and strengthen and develop children's palliative care around the world. And we very much believe that every child around the world who needs access to palliative care should have access to such care. And these are just some children from the Cancer Institute in Uganda who exemplify the need for integrating children's palliative care and also the importance of nurses in providing that children's palliative care. Thank you.
Many thanks, Julia, for that informative presentation. I think you've really highlighted the importance of training nurses as leaders, and also the importance of free online educational resources, just increasing access to that vital information. So, is Eve still on the call? I think Eve is chairing the question and answer session. She may have
Seem to have lost him.
I'm here.
Oh, you're there.
I'm here.
Fantastic. I'll hand over to you then, Eve. Many thanks to all of our speakers so far.
Excellent. Thank you. Professor Julia, thank you for the excellent presentation. So now I'm going to call upon our speakers, Professor Julia, Mary, and Dr. Yakub. Please have your videos on and be ready to respond to the questions that we have. First of all, Dr. Yakub, you're requested to share your contact. Please do.
Yeah, I've shared that. And
Okay.
am I right in thinking the slide will be shared with participants? I'm happy to share my slides as well, which has the context.
Okay. And then there is a question for you. What would be the requirements for palliative care tutor education at Lancaster? I think you could answer that.
Yeah, so palliative care tutor role.
Yeah.
Yeah, so basically, the person should have a PhD, and we do advertise. So if you go to the vacancies at Lancaster University, every advert about recruitment is there, and they do as much as possible specify the sort of requirements. Some of them are mandatory, some too are, desirable and other things. But I'm happy to have a personal chat if the person, link up later on. Yeah.
Thank you. And just to note, for those of us who are looking for where to study, University of Cape Town and Witwatersrand universities also offer courses in palliative care. And then the scholarships we talked about, we really encourage. ICPCN has a central role to play in handling this whole process. And Julia is passionate about children. And when you get these scholarships, we really want you to do some work around children's palliative care. So please, you're here, take advantage of this and be in for the children.
Yeah, we look forward to all the applications for children's palliative care, because that is a core component, isn't it, Eve, of the grant? From King's. So.
And perhaps, Eve, is there a place that applicant can look at the information?
We are going to put out
on some place, and
we will put out the call. Definitely, it will be on the ICPCN website, Compass Ghana, and
APCA and
to reach
King's.
out to everybody. Yes, and King's and APCA and Hospice Africa Uganda. And then there is a request. There is also another institution that say they host a 9-month course annually, which starts in March 2025. We have taken note of that, but there was
South Africa. They also
there was
have e-learning courses.
There was a question which Mary, Julie, and Jakob could respond to. What was the most common method used to assess effectiveness of education?
All right, thank you very much. Looking at the included studies, it came out that the DAP-R scale was used, and also the FATCOP-B, that is the Turkish version. Both versions were also used in most of the studies. And also most of the studies looked at before and after quasi-experimental studies. So these were most of these studies relied on these approaches to measure effectiveness. However, most of the studies were not longitudinal. I think the longitudinal studies were about 2 in the study. So that is that. Thank you.
Okay. Any additions?
So in terms of looking at outcomes of education and nursing education, there's loads of different ways of doing it. You can use the palliative outcome scale or the children's palliative outcome scale. But there are also various different nursing specific tools. So palliative care nursing self-competency tool, a range of different scales that are specifically set up for education and looking at the impact of education for nurses, and both EPIC and ELNIC have scales as well, and I know PalChase and various other organizations have validated scales that we use. So there are a wide range of ways of looking at the effectiveness and the impact of nursing education and education broadly.
Thank you very much for that, Julia. I think, Jakob, you're trying to respond to some of the questions that are coming up to you.
Yeah, I've tried to respond to them inbox, but I'm happy to speak to that as well. Somebody asked about opportunity for postdoctoral fellowship. So currently we do not have some, but we are happy to support anybody to, you know, apply for a postdoctoral position to, you know, which is tenable within Lancaster University. So I'm happy. You have my email. If you can, you know, send me an email, I'll forward it to the director of the observatory who will be able to assist in that regard.
And just to note that the slides and the recording of this webinar are going to be availed to everybody who registered for this session. So yes, you'll get the slides and recording. And then we have another question for you, Mary and Julia. Were there any RCTs from this systematic review?
Hello?
Yes, were there any RCTs?
Yes, few of them.
What were they? Tell us more about the RCTs, those RCTs.
Okay, so the randomized control trial studies we had in this particular review is about looking at nurses before the trial, their knowledge with respect to palliative care, their knowledge, and then their attitude towards death, and then the dying, and also bereavements, and also going into the study and then going through training with respect to a training content encompassing all these things, and also measuring the effect of the training after the intervention. So basically that, then the effect is measured to, come up with the findings.
Great, thank you very much. So we have some useful links in there from Julia as well. Please try to pull down those details, or you can access them when you get the recording. We don't seem to have any more questions, but we have lots of comments thanking the presenters for the job well done. And then a comment, please check out the virtual conference in July on nurses as pathfinders, and let's make things happen.
That's Eve. Can I just say a bit about that? There's a global palliative nursing network, and they're running this one-day virtual conference on the, I think it's the 6th of July, but it's beginning of July. So do look out for it. If you go on the website, it says there's a £20 cost, but it also says that there's funding. So if you haven't got the £20, then that's fine as well. You can get a free place. So do please check that out. It's bringing palliative nurses from around the world together and working in both adults and pediatric palliative care.
Thank you very much, Julia. Steph, we don't have any more questions. I was happy really to moderate the Q&A session. And now I request to hand back the chair to you.
Fantastic. Thank you very much, Eve. So all that's left to say is thank you to our wonderful partners on the One project that we've been working on for about the last 18 months. This is very much a team effort, and we are part of a team, but we're part of a much wider team that we're very grateful for their support. I'd like to thank the Worldwide Universities Network for project funding and the African Palliative Care Association for partnering with us on putting this webinar on. My tech skills are not up to putting this on, so we're really grateful for their infrastructure and support. It really was partnership in practice. And the final huge thanks goes to our panel of experts, palliative care education experts. I'm really grateful for the time that you've taken to present. I'm sure everybody would agree that there's been an amazing amount of information shared in a very short amount of time. So thank you very much, everybody, for coming. As Eve has said, the recording will be shared along with the slides. I think I'm going to try and kind of highlight the whole chat with all the wonderful links in there so I can make sure that we've got all of the amazing information shared in the chat as well, also captured. So thank you very much, everyone, and have a good day.
Thank you. It's a pleasure.
Thank you, Steve.
Yeah,
Thank you, everybody, for listening.